What's up, everyone? So today I'm going to talk a little bit about sciatica. And let's talk about what the sciatic nerve is first. Okay, the sciatic nerve, if you look at the spine, I got a little baby spine here, not a literal baby spine, but a small one. You've got L4, L5, those are your last two lumbars, these last two. And then you've got this bone here called the sacrum. And you've got 5 pairs of nerves that come out of that. A pair each for L4 and L5 that come out through what's called the intervertebral foramen, which foramen just means hole. It's basically made up of the spine above and below come together. They're joints, they're facets they're called, and they make this little hole where the nerves exit from. And those nerves come from the spinal cord, okay, which ends around L1, L2, but then the nerves come down. So what we're looking at is the sciatic nerve is made up of L4, L5, S1, 2, and 3. So all of those nerve roots are going to come together and form the largest, thickest, longest nerve in the body called the sciatic nerve. Now the sciatic nerve, what does it do? It supplies the entire posterior thigh, so think hip to knee, and then the entire lower leg, okay? Because it supplies the posterior, lateral, and anterior portions of the lower leg. When you get down to the knee, the sciatic nerve is going to split into the tibial nerve and the common fibular nerve, which is also called common peroneal nerve. And so that's going to cover the entire lower leg and muscles of the foot as well. So all of that can be effective by any impingement anywhere in the sciatic nerve or its originating branches, okay? Most common cause, let's look at some things here. The most common cause of sciatica, got a little vertebrae here, okay, boop. Oh, that's a herniated disc. So if you look, when I was talking about the vertebral foramen, right, we've got these holes, and you've got these little nerves that exit from those holes. We can see that, right? All right, let's move that around a little bit. So what's going to happen is, if you have a disc herniation, depending on where it herniates, it can herniate into that nerve root. Boop. Okay. So, and it's not fun at all, right? So it herniates into the nerve. Now, of course, the herniation can go into the spinal cord and all sorts of stuff. But again, the spinal cord ends at L1, L2, which is your first and second lumbar region, right in that range. And then we got some branches that come down. But essentially, if the nerve roots come down all the way through, okay? So the disc can potentially herniate into the spinal nerve. That is the most common cause of sciatica, okay? And of course, that needs to be treated with a medical professional. Depending on how severe it is, will depend on what the treatment is, okay? So we're not gonna go down that bunny trail right now. That's something you need to discuss with your health professional. As far as, there could be misalignment, okay? If there's misalignment in what's called a subluxation, it's a less than a dislocation. It's a slight movement of that vertebrae out of place. So we get a slight movement. If we get a slight movement, there could be some impingement, just a little pressure on the nerve. And that's what we call an impingement. It doesn't actually pinch the nerve, otherwise the nerve would actually die. But basically, you get a little pressure on there, okay? So if that happens, then of course you would need it to be realigned, okay? Whether that's your chiropractor or what other health professional, joint manipulative therapist that you would go to, okay? As far as one other cause, and this is something that can be treated by a therapist, but also this is something that could potentially, we could help ourselves with, all right? There is a muscle, so let's try and orient us here, okay? We've got, this is the pelvis, we're gonna go to the back here, okay? We've got the gluteus maximus is gonna be a big muscle. We gotta strip that off, get that out of the way, okay? I believe this is showing part of it. This is, oh, that might be gluteus medius, but we've got, I believe that's maximus on this model. This is gluteus medius. And then we've got this guy right here. That is the piriformis muscle, okay? Why am I talking about this little guy? The sciatic nerve comes together and goes right underneath that. So if we've got this muscle, okay, and that muscle tightens up, it is going to press on the sciatic nerve, okay? It's called piriformis syndrome. Now, the reason I say we could potentially treat ourselves, I'm not saying treat ourselves, but essentially help ourselves with this, I like to use what's called a lacrosse ball, a little rubber ball. It's like a dense rubber ball, okay? Tennis balls are too soft, okay? So this is, it's about the size of a tennis ball, but it's dense rubber, and you can get them anywhere. any sports store. But basically what you can do is sit on that. If you look, just so we can see where the location is, okay? This thing is called our ischial tuberosity. So here's the piriformis again. This thing, that when you sit down, and that's the bone you're sitting on, okay? That's the part of the bone you're sitting on. It's called the ischial tuberosity. So if you look, if you just slid straight up from that, boof, you would hit it, okay? So, and again, it's underneath the gluteus maximus. So, you know, it's deep in there, okay? So again, a therapist can treat that and try and do some trigger point therapy or joint or muscle release, you know, whatever technique they're using. Or you could use the lacrosse ball, put some pressure on it. You don't have to roll like a foam roller. You just put the pressure on it, take some deep breaths. And a lot of times if there's trigger points in there, tension, the muscle will relax, okay? So always check with your physician before doing anything for your medical health. But just giving you some ideas of things that are possible. Your physical therapist or chiropractor may show you these things. But that being said, I wanted to give you basic information on sciatica. It is a common issue for many people. And if you have any questions, let me know. Stay strong. I'll see you next time.